Hello, Create AState. My name is Jarrett Powell. I'm a senior family nurse practitioner student here at Arkansas State University. I have completed all of my formal education here in Northeast Arkansas, so the health and wellness of the individuals of this community are near and dear to my heart. The purpose of this research was to evaluate how well primary care clinics in the region are vaccinating patients 19 to 64 years old who have been diagnosed with a chronic condition as identified by the CDC as being high risk for pneumonia. One may ask, is the pneumonia vaccine really that important? Well, for an individual who suffers from chronic illness, the answer is yes. The pneumococcal vaccine will decrease a patient's risk of getting pneumonia in the first place, but also the economical burden to the patient and healthcare system will be drastically reduced. In 2004, there were 119,000 hospitalizations and almost 2 million outpatient visits for pneumococcal-related infections. Pneumonia infections in adults aged 19 to 64 accounted for approximately $4 billion in direct medical costs. As primary care providers, we should encourage the use of vaccinations to not only increase the well-being of our patients, but also to save billions of US dollars. The objective of this study was to determine if a local primary care clinic was vaccinating patients aged 19 to 64 with a chronic condition appropriately compared with the National Health Interview Survey's statistics. These statistics would then be compared to the Healthy People's 2020 goal for vaccination rates of individuals aged 19 to 64 with chronic conditions. The population of this study was adults aged 19 to 64 who have a chronic condition. The CDC identifies patients who smoke, have heart disease, lung disease, liver disease, diabetes, and alcoholism at risk. They also identify immunocompromised patients such as HIV, chronic renal failure, and nephrotic syndrome. The third section the CDC identifies is patients who have CSF leaks or cochlear implants. This group was not evaluated in this study. Healthy People 2020 identified a goal to have 60% of patients 19 to 64 who have a chronic condition to be vaccinated. The International Health Survey identified that 20.3% of primary care offices vaccinate these patients appropriately. The clinic where I conducted research vaccinated 23 out of 50 patients reviewed. That is 46%, which is much better than the International Health Survey of 20.3, but does not meet the goal of Healthy People 2020. Of the population, 48% of patients diagnosed with diabetes were vaccinated. 100% of patients with chronic liver disease were vaccinated. 40% of patients with chronic kidney disease were vaccinated. 50% of people who were identified as smokers were vaccinated. 50% of patients with chronic heart disease were vaccinated appropriately. 57% of patients with COPD were vaccinated. 33% of patients with asthma were vaccinated, and 50% of patients who have a malignancy were vaccinated. This is simply a helpful graph to demonstrate the finding of the primary care office I did research at. Compared to the national average of 20.3% of patients vaccinated who are high risk for pneumonia age 19 to 64, the local clinic here in Northeast Arkansas did it very well at 46%. Unfortunately, the clinic did not meet the Healthy People 2020 goal of 60%. The action plan of this study would be to present this data to the clinic So they could improve their vaccination rates and to achieve the 20% healthy people 2020 goal.